I'm Anna Peterson, and today I'm going to be talking to you about the drugs that affect Utah County. Utah Drug Monitoring Initiative Annual Report in 2021, since 2022 has not come out yet, stated that opiates are the highest rated drug related to overdoses in Utah. The report stated that because of the manufactured fentanyl that was imported into the U.S. from Mexican transnational criminal organizations from Mexico, this was a lot of the cause of the overdose. The fentanyl comes in counterfeit pills form and in powder form, and also has increased the amount of overdoses. This also in Utah is followed by methamphetamines, which remains highly and large amounts that are also recovered by law enforcement, and they are related to 40% of the overdoses in Utah. Other highly used drugs here in Utah are prescription opiates, heroin, fentanyl, and cocaine. There are prevention strategies. According to the sheriff and Utah County government, Utah main strategies are used through the Utah County Major Crimes Task Force, and they work with several agencies, local, state, and federal, to investigate and dismantle drug trafficking organizations in Utah County. Mostly heroin, which currently seems to be the epidemic here in 2023. That was reported in 2023. They also focus on methamphetamines and their secret labs. They target and arrest those anywhere from street level to mid-level traffickers, and gangs that are related to trafficking these drugs. They investigate and arrest individuals and organizations that are distributing opiate-based prescription pills also. There are several options for rehabilitation here in Utah County. The first step usually is detox, and which the rehabilitation, according to Partnership to End Addiction, states there's detox, but they don't give specifics on where that is. Through lots of phone calls and helping people find detox and recovery the last 5 years, I have found that the only medical detox here in Utah County is Payson Hospital. Otherwise, the best next place would be LDS Hospital. There are some rehabilitation centers that do have doctors that are full-time staff that help them do medical detox, but you have to kind of call around and search because those things have changed up and down with insurances. Then there's residential programs. These are anywhere from 30 to 90 days, and depending on insurance. Then there's intensive outpatient programs, which are about 10 to 20 hours per week, and then you go down from there as you accomplish each step. They have outpatient programs, which are usually low to medium intensity, and counseling groups that are either group or individual therapy. After you get out of residential programs, they usually would suggest that those patients go and live in sober living to be in an environment and learn how to be out in the world and do good and healthy things for themselves. As far as community help, we have Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, the SMART program, which is a self-managed and recovery training program, but usually has group settings with it. According to the Utah County Sheriffs, they also in jail have the OUT program, which allows inmates after completing a addiction recovery program, to go out and work and then come back to jail at night. They also have AA in jail and that addiction recovery program itself, and a thing called RISE, which has volunteers that are mentors for the guys. Thank you for listening, and hope that you learned something from this. I know I did.